Good day, guys, and welcome to episode 104 of the Teacheremilio podcast. I'm your host, Emilio. Today, we're going to talk a bit about the topic you see on the screen, and if you're on Spotify, it'll be Chinese medicine, and I have to bring someone who knows about the topic. And, well, look, without further ado, let me first introduce our guest. We're going to have Ben here. Ben, thank you so much for coming.
Thanks for having me on, Emilio. Great to be here.
Can you tell us a little bit about yourself?
Sure, absolutely. So before Emilio talks me up too much about my Chinese medicine knowledge, I just want to preempt this with I'm a student. So This is a student's perspective on Chinese medicine and what we're going to be talking about today. I am a personal trainer and gym manager over at Visions Fitness. I've been studying Chinese medicine for about 4 years now. I'm most of the way through my degree. I've got 2 years left before I graduate and I can open my own clinic.
Sick. I was about to ask you that. For how long have you been studying Chinese medicine?
Yeah, so about 4 years now. So the degree is 5 years. I'm not quite full-time, but I've been doing martial arts and things since I was 7. So it's always interested me. When I was growing up, my mother worked as a massage therapist in like a multi-modality clinic.
Oh, wow.
Yeah. And there was a guy there. His name is Simon Feeney. He is now the supplier of most of the organic Chinese medicine herbs throughout Australia for clinics. And he worked in the same clinic as my mother. So I had a lot of times to have a chat with him about things. I had some acupuncture done when I was little. It sort of like set me off on the Chinese medicine path.
Interesting.
Yeah.
You know, and somehow it sounds like things are getting connected. You mentioned opening your own clinic and you also said sports science. So what I'm thinking is like sports science, training martial arts, and then Chinese medicine. How does that, tell us maybe, I don't know, how would that be all connected? It sounds like it's all related to the body, right?
It is.
And health.
Yeah. And there's some pretty lame reasons for me getting into some of it, but it's become more sophisticated over time. So
of course.
Children being children, I was really into martial arts as a kid, and the reason when I was about 14 that I really wanted to get into fitness and sports science is I wanted to learn more about the human body so that I could apply the martial arts better. That was my
do a flying kick.
Exactly. Yeah. But throughout that, I sort of just got more interested in how the body works. Like you start learning about it, it becomes fascinating. Then you want to know how to maybe fix it, not kick it so much.
Of course. Nice.
I used to go to the gym a lot throughout high school just as part of my martial arts training. So I did Hapkido. It's a Korean martial art.
I was about to tell you, because it sounds a bit like Aikido.
It sounds a lot like Aikido.
And maybe you get this all the time. So can you tell us what is the difference, or maybe not the difference, but can you tell us a bit about Hapkido?
Yeah, absolutely. So Hapkido is an interesting one. I feel like not many people have heard about it, but it's
including me,
Korean mixed martial art. It does use some elements of Aikido. So Hapkido was invented by a Korean man who was taken back to Japan, I think, during the Japanese occupation of Korea. So he was taken back by the Japanese and basically made to be a servant in a Japanese household. Now that household was fairly kind to him. And at the end of the war, when everything was over, they released him back to Korea. But while he was staying in Japan, he participated in that family's martial arts system. So he was there in all of the classes, used to help out in the martial arts. So he learnt it while he was there. Then when he's gone back to Korea at the end of all of that, he combined it with Taekyon. Taekyon is like the precursor to Taekwondo. So he made this combination of basically Japanese jiu-jitsu, judo, and the kicks from Korean martial arts. So when you see Hapkido, it's a lot of fancy flying kicks and things from Taekwondo combined with judo-type body throws and Japanese stand-up jiu-jitsu grappling. So it's a good mix. I think they use it in the South Korean army now.
Ooh, interesting.
So it's fancy. But so I did that from when I was about, when would I have started that? I did Taekwondo from 7 till about 11, and then I picked up Hapkido from 11 till I was about 23.
Would you say that all this training, doing Hapkido, going to the gym as well, did that let's say, was like the initial push to start doing sports science, or it was more? It was maybe that plus your interest in how the body works.
Yeah, for sure. Well, like throughout school, science was always what interested me the most, and it just made sense to apply that to like the body because I was good at using my body. I went to the gym for martial arts, and then that sort of combined with my interest in science and biology. So I picked up sports science for that. And originally I was tossing up between doing biomedical science or sports science. And then I committed to sports science with the intention of being an exercise physiologist at the end of it. So I did the first 3 years of the exercise physiology degree. I did my placement at an exercise physiology clinic, and I found that, I mean, maybe this is just biased because it was a rural clinic that I was working at. Mm-hmm. But most of the people that you would be working with would be 60 years plus of age. They already had a knee replacement. They already had osteoporosis. They're at this stage in their life where they were already sort of well past when it would have been beneficial for you to treat them, especially with something like exercise physiology.
And I guess with some of those conditions, it would be like, I mean, I guess coming from your perspective, maybe it's like, okay, how can we fix this? But then it's like, it's very hard to let's say, quote unquote, fix or improve this condition, but rather like, I don't know, maybe do minor adjustments to live with it.
And I mean, it does work and it helped these people a lot, but I was struck by how reliant it was on the other person following your advice consistently. So it's the same as going to the gym. Exercise physiology is basically the science of applying exercise to resolve disease. If someone comes to you and they have osteoporosis, we know that bones under stress become more dense. So rather than giving someone osteoporosis aqua aerobics, right, you take all the pressure off their body for fear of breaking their bones. That makes it worse because you take all the pressure off their bones.
Whoa, and then I guess if anything, if there's any impact or like sudden impact,
then the break happens. So instead, exercise physiology would say, okay, we know that we can make the bones more dense by applying controlled impact. Let's get this person stabilized with a rope on a squat rack and get them to jump. Just little jumps. Jumping to apply pressure throughout all the bones of their body. Give them their vitamin D, calcium, K2 supplements. We had this one old Italian dude, he was like 60-something, who had come into kinetic medicine where I worked. And he had full-blown osteoporosis, and we had this guy come in and just jump. That's it. That was his only goal, was to jump. And that impact fully resolved his osteoporosis. And then this man would just continue coming into the gym just to jump, to do his jumps every day.
When you look, excuse my ignorance here, I'll be saying this throughout the episode, but when you say full-blown osteoporosis, I guess, does that mean like throughout the whole body?
I'm not sure where specifically he had it. I think it was usually when you get osteoporosis, it's systemic, but it'll be worse in some areas, right? So you might have it in your hips, you might have it in your legs, you might have it in your arms. Usually it's going to occur worst, or rather it's most problematic when it's in your hips or your spine. Because if those bones degrade.
Yeah, because I guess that's like the...
Yeah.
What could we say? I was going to say like the base, or not the base, but
it's the supporting structure of the body.
Exactly, it keeps everything together.
Yeah. So it worked, and that was good. But I feel like there was a lot of barriers to people being able to adhere to this kind of thing. If you had someone come in with fibromyalgia or hypothyroidism or some kind of chronic fatigue disease, these people aren't going to be able to adhere to exercises. So with Chinese medicine, which is sort of what got me onto that branch, there's a lot more you can do to the patient, or you can help them along with things that don't require much effort on their part to get them to the point where they might then be able to do these exercises to improve themselves more.
And it sounds like the piece missing in the puzzle in terms of you learn about the body, you study it, but then it's not just like, do this, and if you don't do this, then nothing will happen.
Exactly.
But I guess you could do that too and be like, I would recommend based on your condition or based on this, maybe it would be beneficial if you were to do these exercises, let's say, or to doing these things, plus, and then you, as you were saying, you do something onto the...
Yep.
I was about to say patient, but is it maybe not patient, right?
Patient. You call them a patient in Chinese medicine, at least.
But this happened like, did this happen like after your degree, or this happened like midway through
so
placement? Okay.
I was 3 years in doing placement, getting ready for my clinical units. And I did the placement. I was like, this doesn't seem like enough. And it also didn't seem interesting enough in a way, because the solution was always the same no matter what was wrong with them, basically.
It sounds also to me like maybe you wanted to do something extra.
Yeah.
It's not just like, oh, okay, you've got this, please do this, bye-bye, next person.
And there's limitations around what you're allowed to do as an exercise physiologist as well. So, for example, if you go to an ex-physiologist and you want dietary advice, like nutritional information, they can't give that to you legally, even if they know and understand, even if they go and do their nutrition things on top of that, because it's restricted based on its position as an allied health profession in Australia.
Oh, so it's like you would be mixing two things together.
Exactly. But if I go and do Chinese medicine doctors are allowed to give nutritional advice because that's part of the treatment method. We give you dietary advice based on whatever your syndrome of disharmony is, or pattern of disharmony in Chinese medicine.
Oh, I like that, pattern of disharmony.
Pattern of disharmony rather than disease.
It's like you're not sick, you're unbalanced.
Exactly. That's
really?
the entirety of it. Yeah.
No way.
Yeah, 100%. So Chinese medicine views disease like, if you imagine a three-dimensional axis. So you've got a cross, so that's your X and Y axis, and then you've got your Z axis through the middle. Imagine this three-dimensional axis. Health, you're in the center, right? And there's various ways you can deviate throughout this space. Maybe you become hot and cold, or you become damp and cold, or you become hot and dry. You ask the patient lots of questions about their health, and you ask them lots of questions about their lifestyle, and you observe the patient. What is the color of their skin? What does their tongue look like? What do their eyes look like? What is their shen, their spirit in their face?
Whoa, okay.
Feel the pulse, so forth. And that gives you the information about how their health is deviated from the center. And then the treatment method is always to bring it back into balance, is the goal. So that's kind of like really layman's terms, Chinese medicine philosophy.
You know, I have to ask you, or a part of me starts wondering, say, for example, when you say it is something unbalanced, when you mentioned just now the shen, that's like, is it, would you say like your spirit, like your energy?
So Chinese medicine has an array of terms that don't well translate into English, I would say. So qi, the best we can do is energy, right?
Okay.
Qi in Chinese medicine is like air, the breath. It's what flows throughout the body to propel movement and move the blood. And
because what I imagine, you know, when you mentioned like someone's face, a part of me thought, okay, I mean, right. I mean, seriously, the first thing that came to mind is like, let's say if I go, or like if a person goes to see a Chinese medicine specialist or professional, then maybe that person says, oh, do you like your work, for example? And it's like, no, I really don't like it. And I feel down, blah, blah, blah. Which I guess in the worst end of the spectrum would be like, oh, maybe this person may be dealing with depression or excessive stress. But then it's interesting because another part of me, maybe the skeptical in me will be like, oh, but you don't need to go to a Chinese specialist, maybe like a doctor would. I don't know. Have you had that? Or like that concept of maybe people telling you, why don't you study, I don't even want to say normal medicine. Let's say, why Chinese medicine?
Why Chinese medicine, not conventional medicine?
Exactly.
Yeah, sure. So that's a really good question too. And for your example there, with seeing like depression in someone's face and demeanor, that's exactly what I mean by shen, by spirit.
Oh, okay.
Exactly what I mean.
Oh, so that's good.
It's how they emotionally and visibly present.
All right.
You look at their face. Is it sort of like pale, sunken? Do their eyes seem bright and shiny, or are they kind of like dull? Are they looking down a lot? How loud are they when they speak? These are all the things you look at when you're thinking of shen or spirit.
Okay.
Have I been asked why I haven't done conventional medicine? No one in my circle that I guess have regular interactions with, they've all been very supportive. So I've never really had that kind of question thrown at me. But I asked myself the question a lot too, because in a way I was tossing up between that and Chinese medicine. I could go either route. I could have gone, kept my sports science degree, done medicine on top of that, and become a sports medicine doctor, right? It's a profession. It exists. But I feel like medicine takes a very reductionist view to health. And that's apparent in the fact that general fitness and health, general fitness and diet isn't encouraged more in medicine. You go to your doctor, they don't tell you, hey, you should get more sleep, you should go for a walk more often, you should find some ways to wind down, and maybe your blood pressure will drop. Usually. Like they might.
True.
And even if they do, they don't have enough time to convey that in a way that's going to convince the patient. Because you're in there, you got 15, 20 minutes with your doctor max. And they need to work out, okay, what about this person is going to immediately kill them? And they treat just that. That's it. Because the goal of Western medicine is to prevent you from dying, right? Fundamentally. And to like manage symptoms. It's not really there to fix anything. Unless you've been in a car crash and you're having emergency surgery, which is where I think Western medicine like really excels. Or you've got a really bad infection that's going to kill you. They can fix that. That's good. But if you have chronic modest fatigue, they can't do anything for that.
Yeah, it would be like, there is this joke from anyone that is not Australian, like for all international students, we say like, you guys treat everything with Panadol.
Yeah.
It's like back pain, Panadol. I'm tired, Panadol. I'm stressed at work, Panadol. And it's like, man, doctor.
You have a flu? Panadol.
Exactly. So it's like, okay, maybe let me, give me some antibiotics. No. Just take 2 Panadols.
You'll be fine. Yeah.
It's interesting you mentioned that because, as soon as I never thought of it that way. And I think that's probably like a more, it's definitely a different approach.
Yeah. Yeah. So with Western medicine, the goal is to make you comfortable and make you not die immediately. And if they can make you comfortable and not dead, great. If that results in you having negative effects 20 years from now, then that's not their problem right now. They'll deal with that and make you not die then, but then you won't be comfortable anymore.
I'll tell you an interesting story. Both my brother and I, we have the same name, exactly same name and middle name. No, sorry. If you look at our names in the passport, only the middle name is different.
Oh.
So my brother is also Emilio Diaz. And long story short, I went to the same GP that he did, but I didn't know that he used to go to that GP.
Okay.
Right. And then I was doing some training at the gym. This is a few years ago.
Yep.
And I was eating like a vegan or like going from vegetarian to vegan.
Yep.
And I was losing some weight, right? So I just casually asked all the time to the GP, and this is a pro tip for any international student. I always say, let me check my blood pressure, let me check my weight. So, because a part of me is like, it's not cheap,
Yep.
Even with insurance, it's not cheap. So I always tell the doctor, let me just check everything. And I would ask a bunch of questions to make those 15 to 20 minutes consultation to make it
get the
as
most
meaningful.
out of it.
And I was just telling him like, look, can we check my blood pressure? And he's like, okay, yes.
Yeah.
But then when he looked at my blood pressure, he then looked at the screen and I just asked him, look, I'm training more. I changed my diet. He didn't even let me finish. He's like, whatever you're doing, it's amazing. And then I went out.
Yeah.
But seriously, the guy seemed very surprised. And I thought, okay. Good. I'll keep doing this vegan thing.
Yep.
And then, interestingly enough, they say, can you please give me your Medicare card? And I'm like, look, thank you. I'm not Australian.
Okay.
So
you don't have a Medicare card?
Yeah, I have to pay. No, but Emilio Diaz, I have you in the system. And then I was like, wait, is it? And then I told her, and then I said, my brother's date of birth and everything. And she's like, yeah, Emilio Diaz, that's you. I'm like, no, that's my brother.
Oh, no.
And then, and then I said, look, I was born in 1993. And she goes, there is 2 of you. I'm like, yeah, there is.
Yep.
So that's me. And then I had to go back and tell the doctor because I think he put my name and stuff. And then I told him, look, sorry, the mistake, blah, blah. And then he's like, he was looking at my brother's data. So maybe that's why.
So your brother has higher blood pressure?
Maybe higher than me.
Must be.
But it doesn't make any sense to me, because maybe he could see my height. Like my brother's like 180. Okay. I'm like 165.
There's another example of them not having enough time to know their patients.
Exactly. So
and they see so many a day too. That they can't get like familiar with you.
I don't want to make this a rant about
the problems of Western medicine. No.
Exactly. But I also have to ask you because this happens a lot to a lot of international students. Like what I told you of everything being treated with Panadol. What do you guys think about that? Or like, let's say, what's your view on that?
Yeah. So in Chinese medicine, when we're discussing Chinese medicine as well, I think it's important to clarify that most of what you're saying is a metaphor, right? So Chinese medicine was invented as a way to work out what's wrong with you and fix it without any testing, right? It was made 2,000, 3,000 years ago. Whoa. They had no tools to do any testing aside from just observing you. And to explain what was going on, they needed to create this really complex system of metaphors to describe what they observed is going on. So if I talk about cold or hot, it doesn't physically mean you're cold or hot. If I talk about, your liver being damp, or if you have stagnant chi, it's not talking about your physical liver. It's not talking about your spleen. Is a metaphor to describe what's going on with you. And these are the words that they assigned to them when they did their own little autopsies and things at the time. So Chinese medicine thinks that Panadol, most Western medicines, are very cold, very cooling, because they're all anti-inflammatory. They get rid of redness and heat, but they tend to leave a lasting impact because they're cold. So cold things in Chinese medicine reduce heat. So tends to be what'll happen is if you're prescribed really strong antibiotics, so you take a lot of Panadol, you're going to end up with digestive dysfunction. Usually. And in Chinese medicine, basically what that means is you've taken this really cold thing that's put out the fire that sits below your stomach. So again, returning to metaphors, imagine that your body is a representation of the earth, right? You've got the sun up in the sky, which heats the sea, which creates water rising into the atmosphere, which then precipitates back down to the earth. Now, in Chinese medicine, your heart, in this metaphor, is the sun. All the heat comes from the heart. It radiates throughout your body, goes down, it warms the water in the kidneys and the bladder, which then precipitates up and circulates back down. So that circulation is the circulation of energy throughout your body. Really cold things, so things like Panadol, antibiotics, most Western medicines, they will cool down the water that's below the stomach, which puts out this heat that's below the stomach. If you put out the heat that's below the stomach, they imagine that the stomach is like a cooking pot, and it needs this heat underneath it to boil the food, to digest. That's the little metaphor for how digestion works. If you put out the heat that's below the stomach, then the food doesn't get digested, and it can form a blockage which prevents heat getting back down there again. So then you get people with this situation where they'll have diarrhea because the food isn't digested. It's just wet and there's no heat there to cook out the moisture. So they get diarrhea, they'll get fatigue because they're not digesting the energy from their food. And they'll also get irritability, they'll get stress because the heat that normally goes down to the kidneys and the bladder is rising to the head instead in Chinese medicine. It's heating up the upper body. So you get dry skin, you get oily skin, you get pimples, you get headaches.
And I guess this could be like, in general terms, what you were saying about different side effects that you could have from one medicine or another. But as we said, this is now, if you like going to the doctor, that's cool. I don't want to be,
I don't want to discourage anyone from going to the doctor.
Exactly.
They feel unwell. But that's the view of those kinds of medicines, if used to excess, is they'll cause this particular syndrome. And with that, once you've done this to yourself, it's hard to return to normal. So in, I guess, a Western medicine perspective of what's going on there, if you're taking these medications, you're probably causing dysbiosis. You're causing disruption of the gut microbiome, which is responsible for maintaining all of these actions. So Chinese medicine talks a lot about the spleen being the regulator of digestion. The spleen, which is very strange, right? But if you do a dissection of someone, there's a thick band of connective tissue that attaches the stomach to the spleen. So I think perhaps that's where they came up with this concept that the spleen was involved in digestion. But if you look at the functions of the spleen in Chinese medicine, it seems like that might have been their metaphor for the microbiome. That's my perspective, at least.
And, when it comes to Chinese medicine, so you talked about how this is coming from someone who knows nothing about it, and maybe some of our viewers are, in the same boat as I am.
Yep.
When I hear Chinese medicine, I think of things like incense or like harmonious sound for like calming you down. Maybe acupuncture. I don't know, something like maybe pressing your feet. I think I've seen like photos where like it's like, okay, so you can treat anything with your hand, I think. And it's like if you press, for example, like you mentioned the kidneys. So I'm going to say, for example, hypothetically speaking, I've got lower back pain, and then it's like, oh, you just press in a certain part of like your hand or your feet. But I don't know how on track I am with this. So for someone who doesn't know, Tell us, is that close to Chinese medicine or?
A lot of those things are probably styled after Chinese medicine or are sort of encouraged by is the wrong word, but like influenced by Chinese medicine. So there's things like reflexology, which is what you were referring to, where there's this map on your hands and your feet that connects to all the organs of your body. And supposedly when you do so-and-so things, it creates reflexes that are beneficial for them. I don't know that there's much in the way of research in relation to that. That's not Chinese medicine, generally speaking. Neither is incense, exactly. Incense is like a meditative thing. They probably use it in their ceremonies, maybe. It's used in Buddhism. But incense isn't typically used as a part of Chinese medicine. What is used in Chinese medicine is a combination of acupuncture and herbal medicine and lifestyle advice, basically.
Oh, wow, okay.
Yeah. So there's a few different fields. Basically, it depends on what the Chinese medicine doctor has learned. So you could be just an acupuncturist and focus on only acupuncture and try to use that to treat all of the illnesses. You could use just herbal medicine and try to use just herbal medicine to treat all of the illnesses.
What is herbal medicine? Sure. Is it like teas or?
Yeah. So herbal medicine let's give you some background first about Chinese herbal medicine. According to their traditional stories about how it developed, there was this guy named Shen Nong. Shen Nong is a bit of a mythological figure. Right. He popped up sometime around 3,000 years ago. And supposedly Shen Nong made it his purpose to go about the whole of China and try to eat every kind of possibly medicinal plant or animal that he could find. So this included things like cinnabar, mercury-containing rocks. It included all sorts of poisonous things. And Shen Nong, throughout this process, died many times, right? So Shen Nong's probably not just one guy. He's probably a collection of people saying, hey, don't eat this thing. Shen Nong ate it and he died, right?
Oh.
So throughout that process, Shen Nong, whoever he is, collection of people, he noted down the effects that he experienced from everything that he ate throughout that time. Tried every different herb and medicine. So in the Chinese Pharmacopoeia, which is like a series of 12 books that you can buy for like $2,000 from China Books on Melbourne, Swanson Street.
Whoa. But that's for the whole collection,
For the whole collection. Yeah. It's called the Shen Nong Ben Sao Jing, I think. Don't quote me on that. It's something like that.
Mm-hmm.
There's thousands of herbs that they use.
Wow.
And herb is a kind of like a general term. It's not well translated from whatever that means in Chinese, but it's basically anything that will have an effect on your body if you consume it.
Oh, so it doesn't have to be like, let's say, a plant. It could be like a fruit.
Exactly.
Or it could be, okay.
Yeah, it could be. So there's jiao, which is donkey hide gelatin. That's somewhat renowned because donkeys went in China became endangered because they were harvesting too much of it.
Whoa.
Which is a herb, right? But it's donkey hide gelatin. And then there's, Romania. There's chai hu, bunches. So some of them will be herbs. Some of them will be animal products. Some of them are minerals. They use oyster shells. That's a herb. Muli. Yeah.
And so herb is like an umbrella term. For anything that affects your body.
Basically.
But it could be in a positive way and a negative way, right?
Yeah, and in Chinese medicine, none of these are ever taken on their own. So they're always in a formula to try and balance the effects of the herbs.
Oh, gotcha.
So there'll be a principal ingredient, which is doing the primary action that you're trying to get out of it. Then you might have an adjunct herb to go along with that, which will either amplify the effects of the primary herb or it'll try and detract from some of the negative effects that herb might have. And then you'll have guide herbs. So gansao, licorice. Licorice root is used in a lot of Chinese medicine formulas. And the reason for that is that most Chinese formulas are decocted in water. So basically you put them all, however much you need of each of them, in a big pot, you boil it in water, you take out the water, you drink the water to take the medicine. When you decoct them this way, you're releasing all of the chemicals, the phytochemicals, whatever's in each of the ingredients, into this soup. And then they can interact with each other within that soup. to form novel chemicals, different chemicals. So licorice is often used as a guide herb. You'll find it in lots of Chinese medicine formulas. And if you decoct certain things with licorice, it changes what you get out of it in the end. So if you boil cinnamon, guizhi, together with gansao, licorice, you end up with, I think it was 50% more cinnamaldehyde, which is an active constituent of cinnamon, than you would if you just cook the cinnamon by itself. And then the licorice also acts on certain enzymes within your liver, which are responsible for breaking down different chemicals. So this is something that's used in modern pharmaceuticals a lot, which is certain drugs will rely on these enzymes, which are called CYP enzymes, in order to either accelerate how quickly that drug is removed from the system, or to slow down how quickly that drug is removed from the system to increase its effect or increase the duration of its effect. So these herbs are doing these things at the same time. You need to take them together to get the desired effect.
You know, as I'm listening to you, a part of me is like, so for example, when you mention like traditional medicine in a second, or like, let's say conventional medicine, I imagine like the XY axis and what you were saying of the heat. And I'm just going to test myself. I'm going to put myself on the spot.
Sure.
So I guess the reasoning behind combining different herbs is so that when you take the medicine, the imbalance we talked about maybe doesn't occur. Like instead of like, let's say, just taking Panadol and getting cold, and then it's like it's not balanced. It would be like, I guess, one element may push you down, another one up, and then in such a way that I would assume that if we have the three axes, that you've got like, let's say, this radius or like this, I don't know, let's hypothetically speaking, like let's say 5 deviation points or like, so you remain in a radius, let's say like this. And then that's maybe better than getting super cold, super warm. Exactly. Is that like the reasoning behind it?
That is the reasoning behind it.
Okay, good. I'm learning something.
And I guess to go back to the Panadol example, if you took a lot of that, it would push you far into cold. And then you get that specific subset of symptoms related to being pushed far into cold. If you were to just take jigansao, just take lots of licorice, you'd end up with high blood pressure on its own, because of the direction it pushes you in.
Oh, okay.
Yeah. So you can't just take lots of licorice. Licorice on its own won't help you.
So please don't take licorice, okay?
Don't take lots of licorice long term on its own. But when you put it in the formula, specifically with other herbs, that tends not to happen. Now, if someone already has high blood pressure, usually you'd avoid those formula just in case, because you don't want to make it worse. But through thousands of case studies, basically what Chinese medicine has done is, without the ability to apply the scientific method because it hadn't been invented yet, they just used mass wealth of case studies to test over time what causes what, and they worked out that specific subsets of herbs together seems to nullify the negative complications related to each individual herb. So you have to take them together.
And I guess that's where the observation comes in handy, right? Because I guess the Chinese medicine expert would be like, okay, you're experiencing these symptoms or you're having discomfort in these areas of the body, and because of all these practices that have been done from 2,000-3,000 years ago up until today, we know that whenever people experience that pain, if they take this, there is a high chance that it will improve.
Yeah, basically. So if you think of modern medicine as applying science to get really specific information about what you've done, it makes it very quick to improve things. But it's a very small focal point, very small magnifying glass, right? You're burning ants with this tiny beam of information. Chinese medicine, because of how old it is and how long it's been around, has taken an opposite approach of amassing very large amounts of very broad, not very specific information. But when you have enough of it, you see trends and patterns. And the trends and patterns aren't very applicable to telling you exactly what's going on because they're so general. But when you have this much information, you can come up with, it gives you clarity around sort of like when something should work. And the trouble with Chinese medicine is working out why, because the formulas are so complex. We know from experience that they tend to work from these trends that we can see with the case studies. And they tend to work in clinical settings. But when you try to apply it to more rigorous case studies, then you lose the component of individuality with the medicine by trying to apply it to large cohorts, which are all going to be individual, unique cases, which should technically be treated differently in Chinese medicine. So you can't just blanket apply this one formula to everyone.
Oh, and I guess this is also where the observation comes in, because it's like, okay, this may work, but then there is so many combinations that it's not like everyone will have. If someone has a stomachache, it's not like you will always take the same thing.
No, yeah, because
Wow.
do they have a stomachache from heat, or do they have a stomachache from cold? One you might give ginger, one you might give peppermint, or some other variation of that. Both help with nausea or vomiting, but one might worsen it in one case.
There is then, so that's for herbs.
Yeah.
The other one is acupuncture.
Acupuncture.
That freaks me out a little bit.
Acupuncture is interesting.
I think, I don't know if I've told you, but I used to do long distance cycling.
Oh, okay. I don't think you did.
Oh, there you go.
Yeah, nice.
And I remember that cycling triathlons. And I remember that one time, I think I'm putting myself on the spot. When like you, for example, you've got a muscle and then it's like, I tore my quadriceps, maybe.
Yep.
And because I couldn't push down cycling, and then eventually, I said, no, I just cannot do this.
Yeah.
And it was hard to stand up. And then my brother was like, maybe it would be good if you do acupuncture. And
Okay.
I just went blindly somewhere, And to be fair, the person was, seemed really good, very professional. And and then all of a sudden, I was told like, oh, you're going a bit pale. And I at the time, I almost like passed out. And obviously, that's not everyone's experience, right? That's what happened to me. But that I've always had like that very like, let's say, scary when I think of acupuncture, or like say, for example, you know how you get a bunch of needles?
Oh, yes.
And then I
If
don't
you
know,
give blood
or like if you
blood
fall,
test
for
done.
example, like if you fall and then, you get like stabbed.
Yep.
I don't know. How is acupuncture always used like that, or is it to treat more specific things like what I was telling you, like
Yeah.
a problem with a muscle? Or
Yeah. So acupuncture is very interesting because traditional Chinese medicine would say that you could use it to treat. You would more often use it to treat things that aren't muscular. The muscular application.
No way.
The muscular application is kind of new, and you'd see that in dry needling with physiotherapists. They're taking this acupuncture approach and applying it directly to the muscles. Right? If you have an injury, they'll dry needle it. Traditional Chinese medicine uses acupuncture to treat the same things you would with herbal medicine.
So you're telling me that you could have a stomachache,
Yeah.
and then you would use acupuncture to treat it.
Correct, you could.
Whoa.
Yeah, and there's specific points for all of these things. So there's a meridian system in Chinese medicine. The meridian system is basically, if you imagine a series of like highways connected by roads, and the cars along the highways is qi, or energy flowing in Chinese medicine, whatever's propelling movement. If you have an obstruction in this highway, say there's a car crash, the qi can't flow through, the cars can't pass through the highway anymore, that always results in pain. So pain is always obstruction of flow of qi, and you use acupuncture to resolve that.
Oh, okay.
Technically. So if you have any kind of disruption to how this is going, imagine now that this circuit of highways is hollow tubes that are soft. Okay. And if there's low pressure, then the hollow tubes can collapse. And that also causes obstruction and pain. And if the pressure is too high, then maybe qi can't flow through, so the water can't flow through these tubes into the bigger streams because there's too much pressure coming back from the bigger streams.
Oh, yeah.
Causes obstruction as well. So that's kind of how they perceive the flow of energy around the body. And Chinese medicine tries to treat disease by affecting this system of tubes. Now, there's no anatomical structure that matches this system of tubes. What there is the fascia. So the fascia is this connective tissue structure that wraps around all of your muscles in your body, holds everything together, hangs onto your organs, and stops them falling out forwards. And if you follow the fascia, they create these big lines that line up with a lot of the meridians. So, for example, from the base of your foot to the back of your heel, around your gastroc muscles, which are your calves, hamstrings, up the erectus spinae to the back of your head, there's one big long string of fascia that connects it all. And that specific string is the bladder meridian in Chinese medicine. Again, not referring to the actual organ.
Yeah.
The bladder meridian. So the bladder meridian is considered to be the most external meridian. They call it Tai Yang, which is utmost yang, which is like the back of the body, effectively.
Oh, okay.
From yin yang theory. And when you are attacked by an external pathogen, that will often attack that first. So when you are starting to get a cold or a flu, you'll experience muscle aches, pain, shivering, sore back, sore neck, headaches. And those symptoms are sort of like along the back. Now, if you wanted to treat that, you might target acupuncture points along the bladder meridian. And the theory, the mechanism that's suspected to be how acupuncture is working is that the fascia is conductive. Okay, so it can conduct information like nerves can. And by interacting with the fascia, you're stabbing these needles through it. You're twisting the needles around to tug and pull on the fascia.
Yeah, like maybe send in a message. Maybe?
Exactly. Yeah. So you're basically stimulating these big lines of fascia to create reflexes throughout the body that have effects. And some of them are analgesic, so pain, numbing. You can do acupuncture on someone to numb their body such that you can then perform surgery on them without analgesia. This is something they do in China.
No way.
Yeah.
I hope this is eye-opening for you as it is for me.
So if you wanted to do a dental operation, they might do acupuncture on you.
I swear I was about to tell you that. Like, what if I'm gonna get like my wisdom tooth removed? Like,
and that's a system they developed to be able to do these operations without analgesics because they didn't have them, and that was the next best thing. So it's proven to be able to inhibit pain to some extent. People have done these operations, many of them with the acupuncture needles working as analgesic, and it seems to work. They've done like open brain surgeries, they've done dental procedures, removals of appendixes. It's very interesting.
And it sounds very painful, you know?
They should be, yeah.
I mean, so if they treat it well, that's...
Yeah. I think it was, I'm going to misquote this because I don't remember exactly who it was, but I think it was maybe an American president or vice president that went to China at one point in the 80s. Don't. If you Google it, you'll find the right information on this one. It happened.
More or less.
More or less. And while they were over there, they had appendicitis. But because China wasn't very developed yet at the time, there wasn't really any way for him to get the operation done as you would in America with painkillers and so forth to do the operation. So they numbed it with acupuncture and it worked really well. And he went back to America and was like, this is amazing. And that kind of like sparked off an interest in Chinese medicine in America.
Wow. Okay. Yeah. I guess that, that's going to be our homework to like double check that. But no, that's...
Definitely double check that one.
But I think it's pretty cool because I guess when it comes to like... I could be wrong, but I'll get into this in a sec, but I guess there is a lot of skepticism, right? Like,
for sure.
Does that really work? Or why would you do this if you could, But I guess with that story, maybe for this person was like, obviously being a president, it's like, wow, hey guys, this works. Or, I mean, we might be into something. We may not agree with it. Maybe it's not exactly what we do, but there is something there.
Would I opt to go and get surgery with acupuncture needles instead of analgesics? No, I wouldn't.
Okay.
Not when they exist. But it's interesting to know that it can do that.
Or if you've got the option, I think that's also another way to
Mainly I don't want to be awake when I'm having surgery.
Oh, same.
Yeah. So if they can put me under, please, that'd be great. But it's interesting to know that it has that effect. And that there's been cases where it's been done and it seems to work. So we don't really fully understand why acupuncture does any of what it does. And that's the problem with it, because you can't placebo test it either. Because everyone knows if they've had a needle put in them, it doesn't matter where you put the needle, you seem to get some kind of effect.
Exactly.
So you try to do double-blind controlled trials, and no matter what, you've interacted with the system in a way that always seems to have a positive effect. So the control and the non-control will both have some kind of beneficial effect versus the absence of any treatment at all. Whether that's just placebo, maybe it's a really unique way of causing a placebo. But
What do you think about this? I hope it's not like a curveball, but I was thinking maybe this could be almost like, because you were saying, it's interesting. A part of me thought maybe someone listening may be like, okay, Ben, would you go ahead and get surgery with that?
Yeah.
But then when you said that, I thought this could be maybe not exactly the same, but going back to math, and it could be like, you could do some complicated math problems with a calculator or without.
Yep.
But if you've never done the complicated math problem without the calculator, you're gonna really struggle.
Yep.
But obviously you could say, look, why would I write pages of a math problem if I can use a calculator?
Yep.
So I guess maybe.
Exactly.
I mean, maybe it's not the same analogy, but I don't know. I hope I'm getting close.
I get what you mean, and it's like, this was a very useful tool to have, but if we have more reliable methods now, then we'd probably better use the more reliable methods.
Of course.
That's like somewhere where Western medicine excels, right? Surgeries. So I'm not telling anyone to go and have the surgeries done with at-home acupuncture needles.
Or the other way around. It's like you're not saying never get a surgery, just, I don't know, drink this and wait.
No.
How about lifestyle advice? Because maybe that could be one of the parts that gets the most backlash.
Yeah.
Because I guess it could be like very personal, right? I don't know. I'm just thinking, I'm trying to be not negative, but I'm just wondering out of curiosity, maybe that's the part where people could be like, that didn't work for me, that worked for someone else. And I don't know, maybe that's more, would you say that part is maybe more to the Chinese medicine professional? To decide on what or how to give the advice?
Yeah, so lifestyle advice in Chinese medicine is there's a great quote for this one actually. So
go for it.
one of the like original texts of Chinese medicine. It's called the Huangdi Neijing. It's the Yellow Emperor's Internal Classic of Medicine, written about 2,000 years ago. One of the very first sections of that book. It's written as the king or the emperor at the time asking his physician questions about medicine and health because he wants to know more about medicine. So the whole book's written in this dialogue between the king and his doctor.
Oh, whoa.
Yeah. So the king asks his doctor, Chibo, he asks him, why in ancient times did people live so long and why were they so healthy? So this amused me, right? Because this is 2,000 years ago and they're asking the same question. Why did people in the past, why were they all so healthy? Why are we all so sick now? And his doctor replies, the people of the past lived regular lives. They would wake at the same time every day and go to bed at the same time every day. They would eat regular meals at regular intervals and never to excess. They would get regular amounts of activity and they would never overstrain themselves. And that advice, being the first bit of advice in this 2,000-year-old book about health, is exactly what we tell everyone to do still.
And that's crazy because that really, it's almost as if you're talking about today's time,
Exact parallel, right? At the moment, if someone comes to me and say, hey, how can I generally be more healthy? I'd say, have a set wake up and sleep time. Wake up at the same time every day. Go to bed at the same time every day. Try to eat your meals at the same time every day so your body knows when food is coming and it prepares for it. Try to get enough activity in, but don't over push it because then you'll injure yourself or you'll get sick, you'll run yourself into the ground. It's exactly the same fundamental basics of medicine. So when I read that, it was like the first chapter of this book, I was like, aha, great, okay. At least they got that right. I know that they're at least talking about health because that's the fundamentals of how to be healthy. So that's the general dietary and lifestyle advice of Chinese medicine is be regular, don't do anything to excess. That's fundamentally it.
Wow. Yeah. We say, in Venezuela, we have a phrase that translates to everything in excess is bad.
Yeah.
Or I guess like the English equivalent is something like everything in moderation, right?
Yeah, exactly.
So even if like going to the gym is good or basically anything, whatever that thing may be, if you get too much of it, it's not good.
Mm-hmm. Yep. There's another one that I like from Chinese medicine, which is the difference between a medicine and a poison is the dose.
Whoa, that's so powerful.
Depends what you have, right? Yeah, you exercise too much, it's poison. If you sleep too much, it's bad for you. If you drink too much alcohol, it's bad for you.
Okay, there you go. You're not promoting drinking. Let's just be, we don't want to get any cuts.
No. Very much moderation in that one in particular.
Of course. Interesting.
But yeah, basically it just advocates moderation and consistency.
And I suppose it would be like very personalized.
It would be, yeah.
So it's not always like, oh, just do this.
Based on your constitution, moderate exercise might be a lot more for one person than someone else. Or a moderate amount of food might be a lot more for someone who's doing a lot more activity. So it's all in relation to your lifestyle and how you're built. Yeah.
This is very, I feel like I hope the same is for our viewers, because it's like I'm learning a lot. I have to say.
I hope so.
And when it comes to, and let's say thinking about Ben today, because you've got this sports background or like your studies in sport. By the way, quick note, I have to say that it's really nice that you didn't have any backlash from family, people around you.
Oh, yeah.
Because I guess, sometimes in Asian cultures or even like in South America, it's more like you studied this, you should continue doing this, or why would you shift directions?
Yep.
So I think it's really nice, and that's like very good, big attribute here in Australia.
Oh yeah, absolutely.
I mean, not to say that everyone from South America or Asia, if a person wants to change careers, is like no, you're forced to do it. But I guess there is a bit of a societal pressure there.
For sure, yeah.
So it's good that you didn't have that.
I think individuality is definitely more pushed here. You're expected to go out and do something different to everyone else, and that's sort of commended in a way in Australia to some extent. So I'm very lucky in that.
And when you combine those things, because I also wanted to touch on this, like now you look really fit, like you train obviously, so I guess you continue training. Did you continue, are you still doing Hapkido now?
Not at the moment, no.
Okay.
So I would love to if I had the time.
I know it's tricky,
That's a common excuse. If I had the time. If I really liked it, I'd make the time. But
let me check here with years of what would be some lifestyle advice for you.
Sure. For myself. Ooh.
But no. I'm just wondering, how are you like combining all these things? Because you mentioned you're a manager at a gym.
Yeah.
I guess you are using all the things from your studies, from your training, as well as from this, right? From Chinese medicine studies.
Absolutely. So the reason I picked up a manager role at all is because the end goal for me is to open my own clinic at some point. So I needed some experience running a business, right, in some capacity. And the gym that I'm working at gives me a lot of exposure to how business is run, because it's a family-owned business. So it's not like I'm working for Anytime Fitness, right?
Exactly.
Which the management of would be completely not applicable to.
Yeah, it's like, just shoot an email to this person, but I guess this one is maybe more personal.
Exactly. Everything's between just me and the owner, mostly. So I get to see how things work from a business perspective, which is going to be super valuable to me. So even though it's a lot of work now on top of my studies, I think it's definitely worthwhile.
Awesome. By the way, congrats on that.
Oh, thank you. So combination of everything I've done. So right out of high school, I did certificate 3 and 4 in fitness, so I could be a personal trainer. So that's how I sort of make money while I was studying. And then I did my sports science degree. So the combination of that and my sports science degree got me my current job, which is great because in a way, this lets me get in enough exercise and activity to be healthy while also making money, while also studying. So it sort of knocked the nail on the head for me needing to set aside separate time to be fit in a way.
Exactly.
I'm obligated to be fit because of my job now. So that's great. That's good. It's also, I think, only manageable because of my time in martial arts, right? If martial arts builds anything, even if it's not fighting skills, it's discipline, I think.
Whoa.
Right?
So true. Yep.
Yeah. So the ability to make yourself wake up at 5 a.m. to go to work so you can make money before you then have a class later in the day. So that, I think my schedule at the moment is like 60 hours a week of study and work combined. So not a lot of recreational
Now you know how international students feel.
Yeah, I reckon. Yeah, because you guys don't have to, you don't get any like government support with uni payments. So you just...
No. The biggest support we get is that whenever we've got holidays, we can work full time.
Yeah.
Or like we don't have caps on how many hours we can work.
Yeah.
So like the holidays are just to work and save money for the next, the next intake payment.
And that's hard. Yeah.
No. And I think it's pretty cool too, because, I've also mentioned in previous episodes that there is this idea that, for us it's very easy, or for, let's say, people in developed countries it's very easy.
Right.
And, it's good you're saying this, because it's not like, Australians are lazy or anything along these lines. It's, well, that's very good.
Yeah. Yeah. It's challenging. I can imagine how hard it would be for international students, especially because at least I'm used to living here. Like I grew up here. I know how it works. But if you're dumped here and you have to work to make a living, and then you're also studying, then you could get deported at any point if you don't meet your visa requirements.
Exactly. Look, talk about imbalance there.
Imbalance, exactly. Yeah, here I am advocating balance and getting on myself, but
And Ben, when it comes to the future, would you like to, since you're saying you would like to open your clinic, are you thinking more? It's interesting because you're hitting so many things. As in, you are dealing with customer service right now, with how the business is run. Yet you also want to open your business. Are you thinking more like maybe at the very early stages you would like to treat people more using Chinese medicine and your knowledge from your degree?
Yep.
And then, I don't know, maybe, let's say, run the business that way? Or have you thought a bit about what you would like to do? Or
Yeah, I've thought a ton about what I'd like to do. Because obviously, second degree, I feel like at this point you need to figure out what you want to do to some extent. So right off the bat, before I even started this degree, I was thinking about what I wanted to do with it this time.
Wow, that's very...
Because sports science was a bit of like an impulse choice. You're in high school, you're finishing year 12, you want to go to uni. What do you study? What seems interesting? Fitness, sports science, that'll do. Not too much thoughts about what kind of jobs you can get with it at the end. This time, I was thinking a lot about what can be done with the degree at the end. So for me, the goal was to open a clinic. My partner's studying naturopathy, so Western herbal medicine, you might call it.
Okay.
Yeah.
So then you could be like, if you ever get a skeptical in your clinic, you're like, no worries, we've got a specialist.
For you, exactly. Yeah, and she also has done psychology. So
perfect.
She's got Western herbal medicine, nutrition, psychology side of things covered. I'll do fitness and Chinese medicine. And the goal is to open a multi-modality clinic at some point.
Amazing.
Yeah. So that's the plan. Obviously, we need to get some experience first.
There you go. And this is where being a manager...
management comes in. Yeah.
It's interesting. And I guess, for future patients, you'll be like, look, you've got this or that. It doesn't matter where it is. We have got you covered.
Exactly.
Nice. Look, we touched a bit on international students and with the Chinese medicine, and say, for example, with being an international student, something that happens to us, and I still remember so vividly when I walked into my first lecture and I was like, I don't want to raise my hand and ask a question because I was surrounded by you guys, a bunch of local students. How is it in the Chinese medicine class? Did you have like the reverse? Because look,
a little bit.
Look, out of, I'm guessing Chinese medicine, maybe a lot of your classmates are from China?
They are, yeah. Yeah, so in my current class, I think that there are 5 of us who are Australian, and the rest of the 20-odd classmates I have are Chinese.
All right.
Or Malaysian or Vietnamese.
So it's like a quarter Sorry, a quarter of the class Australian. Wow.
I would say so. Something about that, yeah, in the Chinese med units. And the lecturers are all Chinese as well, or Vietnamese, which is interesting. And they can all speak Mandarin. So sometimes questions would just get thrown to the lecturer in Mandarin and they'll respond in Mandarin, which is fine. But we're all like, what just happened?
Hey.
Yeah. So, reverse there a little bit, which is interesting.
And how do you feel in that setup?
I probably don't have the normal response. I'm just like curious. I'm like, I wish I could speak Mandarin right now. Like, I want to learn that. That'd be sweet.
That's so
to me,
good.
every time they have these conversations, I'm like, this is fine. Like, if I recognize some of it, I'm learning. This is cool. So I'm just like bemused and interested the whole time.
Which is the complete opposite of, I mean, I'm not saying you would say this, but I mean, I guess like the complete opposite side of the spectrum would be like, we're in Australia, talk English, go to your country type of thing.
Yeah, that's true.
But it's really good that you've got that, because it's like,
Yep.
just embracing learning, basically.
I did a personality test once, and it came up that I am in the 2nd percentile for agreeableness and like the 98th percentile for openness to experience. So what that means is that in a room of 100 people, only like one other person would be more likely to say no to something than me.
Oh, okay.
So very disagreeable. But then only like one other person would be more likely to say yes to something new than me. This is a weird mixture.
Whoa.
So
okay,
I'm I'll disagree with most things, which probably explains why I'm in Chinese medicine rather than conventional medicine, because I'm like,
yeah.
Why
should I do this if I can do this other different thing?
Why should I do any of the things that society has told me to do so far? Oh. But also I'm really interested in everything that is possible.
I found that interesting, and I think we have that in common. And just because, but I'll tell you, with your classmates mostly.
Okay.
Just because thinking about it, I've got a lot of students from Asia.
Yep.
But also, not just that, like I just recently, and I'm preparing for a Japanese exam, and I don't know if it is because I'm in Melbourne. I don't know what is it, but a lot of the test takers are same as what you were saying, like from primarily, let's say, mostly China, and then let's say other parts of Asia.
Yeah.
So I would be in a room with like 100 people, and there would be like 5, 10 non-Asians.
Yep.
And then it's like, I mean, a part of me was more like, what am I doing here?
Yeah.
Type of.
Yeah.
But I like that approach of, I would like to know a bit more.
Yeah.
And I guess you have been practicing a bit of Chinese, right?
A little bit, yeah. I suspect maybe I probably have that viewpoint because this is my home country and I'm comfortable here. So I see this a regular thing and I'm like, I just want to know about that. Like, I don't feel threatened like I might if I went to China and everyone was speaking Mandarin. I didn't know what was going on. I feel like that would be like a scarier position to be in.
Oh, 100%.
Whereas here I'm like, well, the university is English. If I get confused, I can ask them in English and I'll still get the answer I need.
Or you could just wait till the end of the class, ask, shoot an email.
Yeah. Yeah.
That's a very optimistic way of looking at it.
Yeah. Yeah, I don't know. It's been good. I've enjoyed it.
Look, Ben, it's been amazing. And before we get closer to the end, I also have to ask you something because, lots of people listening, watching are people who either want to call Australia home, who maybe came to Australia and they're trying to, finish up their studies.
Yeah.
Perhaps they just want to come and improve their English. So with all your, I'm just thinking because at the gym where you work, maybe not everyone has English as their first language.
For sure.
So
yeah.
Anything you would recommend, and with also your experience learning Chinese, if I say it, maybe it's not going to hit the same way. So anything you would like to say to people who are, let's say trying to improve their English, who are here in Australia, any comments, any tips?
Find someone who's just willing to talk to you in English and who isn't going to judge you for the way you speak, I think. Because
Nice.
Yeah, because what's been most helpful for me, I won't demonstrate my Chinese language because it's still very poor. But what's been most helpful to me starting out is just like having friends that can speak that language and don't mind when I practice. And I feel like having someone to talk to in the language has just been the most helpful thing.
Nice.
Yeah.
I guess a challenge, like someone watching could be saying, yes, Ben, but my English is not that good.
Yeah.
So...
Yeah, I guess also just like don't be afraid to ask questions. I feel like I hope that most people would just be willing to help if you can ask for it.
It's a very good point, and I think that's actually how this episode happened because out of asking questions, talking to you, I said, "Hey Ben, I would like to bring you to the show," and then boom, you agreed. So big thank you.
Yeah, you're welcome.
Now I also have to say, because we've been talking about health. Chinese medicine, the body. Any advice? There may be someone watching is like, look, it's interesting because now we're gonna start Christmas. Usually this is the time when we're gonna get a few kilos. or maybe in Australia getting your summer body. And then, we get into New Year's resolutions. Maybe you're going to be pretty busy in January thinking about it.
Maybe. Hopefully so.
And then I'm just wondering, for someone who wants or who may be thinking, it would be good to get maybe some general tips. Obviously, as you were saying about Chinese medicine, a lot of the what you tell someone might be very specific, but anything that in general you think would help someone who says, look, maybe I want to, let's say, improve my general health. Anything you would say?
Improve their general health. Again, it just comes back to moderation. Like, you can have that cake, just don't eat the whole thing. You can have your Arnott's mint slices, just don't eat the whole packet. You can have your fried chicken, just don't have it every night. Like, my approach to health and fitness is not one of restriction. I think whenever you create rules that you can and can't do something, then at some point you're going to want to do the thing you told yourself you're not allowed to do. Rather, allow yourself the little things and just try not to overindulge.
That's a very good point. And this reminds me when students ask me about their preparation for the test, and sometimes I tell them, look, which is a bit more extreme, and I would be like, look, for these 2 weeks, you gotta be like just obsessed with reading, listening, immersion in English. Like, put aside anything or as much Spanish, if the student speaks Spanish or your mother tongue, as you can, for obvious reasons. It's almost like, I'm thinking in terms of the gym, it's like you're gonna have a bodybuilding competition. Maybe the time to eat chips is not before you get on stage.
No.
Maybe you can do that after. So that's what I would tell them. So I don't know. It's interesting. A lot of I usually do a lot of comparisons between learning a language and the fitness. And fitness in general, because I think it's like very similar. I mean, they can be related.
Consistency is key.
Exactly.
Basically. Repetition, consistency. For sure.
Nice. Well, Ben, look, it's been awesome having you in. I had a blast. I've learned a lot. I hope, I'm sure that we're getting people thinking the same. Maybe, in the future, when we get closer to opening that clinic, or maybe for a different topic, we can have you back again.
Maybe next time we can have a bit more of a discussion about exercise or fitness.
Oh, 100%. I think that'll be...
We missed that topic this time around.
True. No, but look, and this is the thing about the podcast. There is so much to
There's always something to talk about.
Cool.
Yeah.
And okay, look, so then let's lock that in soon.
All right, easy.
So look, big thank you. And also big thank you to you guys, because you are probably here with us on YouTube or maybe on Spotify, wherever you were with us. We were part of your day. We had a fantastic time here, and I hope that you enjoyed the episode as much as I did. In the meantime, once again, thank you for tuning in your commute, going out, driving, whatever you were doing. Massive thank you. The best way to support the show is to share it, tell people about it. And again, Ben, thank you so much. It was great having you in.
Thanks for having me on. It's a great
and
time.
This was episode 104. Don't miss me too much. I'll see you next week. Take care and bye for now.